Welcome to eHealth Radio. I'm Linda DeWitt. Have you or a family member ever felt so depressed that you've considered suicide? Well, Community Health Network's Vice President of Behavioral Health, Suzanne Clifford, is with us today to talk about this very important issue and the many ways that you can receive help. Suzanne, how common is suicide in Indiana and across the country?
You know, Linda, unfortunately, it is an alarming public health issue in the U.S. and in Indiana. For example, in Indiana, more people die by suicide than homicide. And it's the second leading cause of death among youth, 15 to young adults, 34. And it's the third leading cause of death among children, 10 to 14, which is an alarming fact. Being a mom and having children of that age, it's scary to think that they could be at risk of suicide.
And I understand that there has been some local research about Indiana high school students who were surveyed about their thoughts about suicide.
Yes, we were actually very alarmed by some of the results. 19% of Indiana high school students surveyed reported that they seriously considered suicide, and 11% of high school students reported that they actually tried to commit suicide.
And of course, it's the fourth leading cause of death among 35 to 54-year-olds. So we're not just talking about youth. This really affects all aspects of society. So if we're looking at signs and symptoms to watch out for, if you have a loved one or even if somebody is going through thoughts of suicide themselves, Suzanne, what are some of the signs that we should be concerned about?
Yeah, some of the most serious signs that a person's at imminent risk of suicide are, but aren't limited to, talking about wanting to die or kill themselves, looking for a way to kill themselves, like saving up prescription medicine or looking for a gun or searching online, and also talking about feeling hopeless and not having a reason to live. And another way that sometimes people say it is they want to go to sleep and not wake up if they don't really want to talk about the word suicide. So if you hear any of these things, you really do need to call our crisis line if you're in central Indiana, which is 317-621-5700. Or if you're outside of central Indiana, the National Suicide Prevention Hotline is 1-800-273-TALK. 8255 is the last piece.
And what else is Community Health Network doing to address the problem of suicide?
Oh, you know what? We really are taking this on as a serious public health issue and trying to educate our entire team, whether it's primary care, emergency departments, mental health professionals, on suicide prevention. We're using the latest information that we can. So much has been learned, and we're really putting in a robust program to prevent suicides.
You know, there is also still very much a stigma that is attached to the subject of suicide. This can make families that are dealing with suicide and that issue afraid to seek out help. So what would you say to those families?
Oh, yes. It is so difficult when you have a loved one that's depressed or having thoughts of suicide. I've known a lot of people who have been in that situation. Many people have trouble accepting this illness, both the individual as well as their family members. And there is a lot of stigma and misinformation. But it is a disease just like any other disease. And what do you do when you have a disease? You go to the doctor. And that's really critical. It's important also for people to know a lot of people don't talk about this, but you're not alone. Help is available. It's so much more common, unfortunately, being one of the leading causes of death. This happens a lot. Unfortunately, we don't talk about it. You know, if your loved one or you are thinking that maybe you need to seek help, the answer is almost always that you should. You know, and the worst case scenario, you've gone to the doctor one more time than you need to, but it's worth it to go ahead and seek treatment.
So one more time for the local crisis line that people can call?
Yes. In central Indiana, it's 317-621-5700. And the National Suicide Prevention Hotline, if you're outside of central Indiana, is 1-800-273-TALK. and the talk is 8255.
Suzanne Clifford is Vice President of Behavioral Health at Community Health Network. For more information about severe depression and suicide, as well as other behavioral health issues and resources, visit ecommunity.com/behavioral health. You're listening to eHealth Radio at Community Health Network.